Hello and welcome to this week's OsteosynArthritisCare blog. Osteoarthritis is a common condition impacting joints around the body such as the knees, wrists, hips, shoulders, elbows, and more. Depending on severity, the condition can range from a light annoyance in early stage osteoarthritis to a complete disruption of your ability to act and move on a daily basis. In this week's OsteosynArthritisCare blog, we'll be talking about the 4 stages of osteoarthritis. There are generally considered to be 4 stages of osteoarthritis, but we wanted to take a quick moment to talk about what some professionals refer to as stage 0, which is normal, when there are no joint issues, symptoms, or any concerns of note. Stage 1 of osteoarthritis is when you may start to become aware of an issue in your joints. This isn't true for everyone. There are those who may enter stage 1 without noticing any symptoms, but others may start to experience light joint pain or discomfort. It is often referred to as early or doubtful. At this point, there may be a bit of cartilage loss in the joints. The space between your joints, however, should not be getting smaller at this stage. There won't have been enough cartilage loss yet to appreciably change the normal distance between your joints. During stage 1, you may also begin to experience small bone spurs at the ends of your joints. Bone spurs are small growths that form on the ends of bones. In stage 1, these shouldn't cause much, if any, pain or discomfort, and the management approach from doctors is non-invasive. The question, can osteoarthritis be reversed, is frequently asked by patients at this point, and the answer, unfortunately, is no. It can be managed though. The best time to start managing the condition is during this early stage 1, and the management routine will frequently consist of lifestyle changes along the lines of dietary changes, increasing low-impact exercise time and types, and introducing supplements like chondroitin sulfate and glucosamine to your routine. The changes may feel small for some, but early management is key to dealing with osteoarthritis. If you think you're entering stage 1, be sure to talk to your doctor. Stage 2 of osteoarthritis is frequently referred to as mild or minimal osteoarthritis. During stage 2, the area between the joints begins to narrow as some of the cartilage that makes its home there slowly breaks down and the tissues around the joint harden. When looking at an X-ray, bone spurs may be noticeable to a radiologist. It could be an early source of pain or discomfort. The narrowing of the space between the joints is unlikely to be visible yet. In stage 2 of osteoarthritis, there are some things to be aware of. You may start to notice pain or tenderness around a frequently utilized joint. There might also be some stiffness occurring after letting a joint rest. If you notice anything like this going on with your joints, it's time to talk to your doctor to discuss coping strategies for osteoarthritis. If you're asking yourself, how quickly does arthritis spread? The answer is variable. Sometimes it progresses slowly. Sometimes after something like an injury, it can progress more quickly. Once again, let's talk about management routines, but this time for stage 2. At this stage, your doctor is likely to increase and enhance the non-invasive measures they take for management. They will set target weight goals to reduce the load your joints are bearing, and they will suggest muscle strengthening and mobility exercises to add to your routine. They will likely recommend supplement options again, like chondroitin sulfate or glucosamine, and set up an over-the-counter regimen if you're experiencing pain or discomfort. Stage 3 of osteoarthritis comes with an important question frequently asked by patients. How painful is stage 3 osteoarthritis? When stage 3 of osteoarthritis is reached, the pain can be moderately severe and frequent and revolves around joint use. There's often pain around everyday activities like walking, bending over, kneeling, typing, or picking things up. The pain is usually tolerable, but will require time to manage and get used to. Stage 3 often presents much more noticeably on X-rays as the space between the joints narrows even more. There is also a very minimally invasive procedure known as an arthroscopy that your doctor may want to utilize to increase the certainty of a diagnosis. This procedure involves the insertion of a small scope into the joint to allow for direct observation. The procedure is minor, but gives the doctor a lot more information to work with. When osteoarthritis progresses to stage 3, management options can get a bit trickier. In addition to weight loss, exercise, and supplement routines, your doctor may create an over-the-counter anti-inflammatory pain reliever schedule with you, or even prescribe a stronger pain medication. Stage 3 is also when doctors begin to use hyaluronic acid or corticosteroid injections into the joints for pain relief. These typically take multiple shots over the course of several weeks, but can reduce pain for several months after they take effect. Stage 4 osteoarthritis is the most severe progression of the condition. Most people dealing with stage 4 osteoarthritis experience a lot of pain when utilizing their affected joints. The stiffness, inflammation, and swelling can also sometimes be quite severe. Daily activities become difficult, and the quality of life often decreases due to the negative impact of the combined symptoms. Stage 4 is usually diagnosed via a combination of symptom analysis, physical examinations, X-rays, MRIs, and lab work. By this point, the amount of cartilage in your joints is significantly less, and in some cases almost completely gone. Bone spurs may grow larger, and there is significantly less synovial fluid to lubricate the joints. At this point in the progression of osteoarthritis, lifestyle changes and non-invasive treatment measures may no longer be enough. Doctors will likely increase your anti-inflammatory regimen and other prescriptions while exploring options. Surgical methods may be suggested, including osteotomy or arthroplasty. An osteotomy is a surgical procedure that involves cutting a small section located around the damaged joint. This is intended to shift the location of where weight sits on that joint so that it rests on more intact cartilage. An osteotomy is typically the option of choice for younger osteoarthritis patients who are still active and have uneven joint damage. It requires that the tissue in the joint is correctable and that inflammation is minimal. It frequently results in reduced pain, but may also lead to an inevitable joint replacement down the road. Doctors don't recommend methods like this lightly, so make sure to take advantage of their expertise and ask any questions you may have about such a recommendation. An arthroplasty is another procedure in which the joint, or just a portion of it, is replaced with a prosthetic artificial part. This may involve installing a cap on a joint or replacing the whole thing. It's worth noting that hip and knee arthroplasties are the most commonly performed surgeries in the United States. The recovery can be annoying, but the procedure often results in significantly less pain, more mobility, and a return of quality of life. With all that said, we want to take a quick moment to address one more frequently asked question when it comes to the conversation about the 4 stages of osteoarthritis. Is osteoarthritis hereditary? The answer is complicated, as experts believe that there is a genetic component in having a predisposition towards osteoarthritis, but that the condition itself is not hereditary. Many factors play a role in the development of osteoarthritis, including weight, age, sex, and past injuries. If you think you may have an increased risk, please talk to your doctor. Thanks for joining us for our newest SciNutriPure blog, where we discussed the 4 stages of osteoarthritis in depth. OA can be a daunting condition, but understanding always starts with a strong dialogue. We hope to see you again next time.